Hi everyone, Dr. Timothy Gallagher.
And Dr. Michael Marciello.
And we're from Maragal Medical. This week we're going to talk to you about treatment options for tendonitis or partial tendon tears. There's a lot of treatment options out there. At Maragal Medical, we're using cutting-edge technology to make sure you get the best outcome for your athletic or overuse injury. It's going to be a lot of great information on this one, guys, so stay tuned. Okay, Dr. Mike, I kind of say this all the time. Sometimes in practice you have, a string of patients rolled together and you start to feel like some of these conditions are contagious. So we've had a few patients that have presented with more tendonitis right at the base of the hamstring where it originates, right at the sits bones. And this is an interesting injury because typically we see this with runners, and here we are in January, and those that are prepping for the Boston Marathon have been very fortunate with the mild weather. They're training. What are some of the treatment options that we can do here at Maragal Medical to make sure that we're getting to the root cause of their problem with a speedy recovery?
Well, when you think about the running injuries, I think we're seeing some of these patients because they really have been injured in the past.
Yeah.
They were running, but now as the season starts, the people trying to get back out and exercising. There's cold weather, yes, but yet they're starting to train for the races like Boston Marathon here. But the concept is that the asymmetries, the overuse, the aspects of little leg length discrepancy, one leg shorter than the other, a hip that's not moving as smoothly as one side compared to the other, underlying arthritis at the knee or the hip, all these things can give a little bit of asymmetry. That's what we're looking for to try to see why did that injury occur. And we're talking about a tendonitis, but even partial tears of the hamstring. Typically, a person may really run, sprint hard, and come up with a hamstring pull. Yeah. And that happens a lot in a lot of athletic injuries. But we're talking now the repetitive overuse, the long stretch overuse tendonitis and irritation. And that's just where it attaches, right where we sit. So those are the type of injuries that we can try to tease back of really what caused this.
Yeah.
And then when we hopefully determine at least what some of those reasons are, then we can start looking at the intervention, chiropractic adjustments, the aspects of laser, the aspects of trying to use the soft tissue, along with the adjustments, along with, again, recovering and rehabilitation in a sense of strength training.
Right. It was interesting. 2 of the 3 patients this week that came in with that, tendonitis right at the issue were runners. The other one didn't really have a history, and she had reported to me yesterday that it just all of a sudden happened after sitting for 2 hours in the car, and I kind of said, well, that wasn't your cause. You got a lot of history with lower back, and certainly in this case she had a tear in the cartilage in her hip, or labral tear. And really I tried to emphasize too that we can look at the pictures, the x-ray, the MRI. We can see the damage to the tissue, whether it's a partial tear or tendonitis, but really that's where the work begins. That's where you get to put on your detective hat, and as I explained to the patient, get to figure out, obviously something over a long period of time was not moving correctly. So as you nicely pointed out, and it was like all 3 patients had that. The pelvic asymmetry, there was definitely a huge discrepancy between the arch length, their flexibility issues. And really that's the key, is to make sure that you get an accurate diagnosis and that you're emphasizing to the patient that, okay, this is where it hurts, but we need to figure out the root cause of this and what wasn't moving correctly and fix that. And that's of course where the combination of the chiropractic, the physical therapy comes into play. And we've got some great modality options with class 4 laser. But one of the runners went down the path of the typical orthopedic intervention, and we talk about the dangers of cortisone all the time, and we had proof that in a September MRI, we had some damage, went ahead, got the cortisone injection, ran another race, and caused twice the amount of damage. So, when cortisone is so dangerous, right, and those athletes, particularly the runners, are looking for a quick solution, what are some of the treatment options that we have in our practice in terms of the regenerative injections?
Yeah, there's certainly a lot of ways to try to treat it, and certainly let's not forget the aspects of some of these athletes really overdue, and even if they didn't get an injection, they just keep on pushing and pushing. So if you're pushing through those pains and leading down the road of compensation, you're going to cause strains elsewhere. So again, we're trying to identify those compensating positions, prevention of the second component of it. But once you've got those injuries, we want to get in there early. So we want the person, you want to come in early to see, I'm getting this hip pain on the front, but it all started in the back. That's the time to kind of get in. But now we're talking inflammatory processes that we can kind of shut down quickly. If we get to the injection level, then we're looking at the platelet-rich plasma injections that we do, part of our regenerative injection kind of treatment programs, because now we're helping repairing the damaged tissue, the inflamed areas that can actually result in all these additional problems that come into play. Sometimes you get the MRI pictures and it's not quite clear with the inflammation to know, is that a partial tear? Is it just inflammatory? Is it, some changes at as you mentioned, the person who had the back issues, that muscle may have been weakened because the nerve input was decreased and the muscle bulk was decreased. So all those things we're putting our detective hat on for sure, but we have to kind of intervene to prevent it from getting worse.
Yeah, and those important Shelley injections too, where they have a high concentration of regenerative cells, really come in handy when there's actually tissue damage like a partial tear or the arthritis. Lots of treatment options that are actually getting to the root cause of the problem. And I think most of the people out there would understand the benefit of utilizing an injection where it's actually working on repairing damage to the tissue versus just masking your pain and potentially making it worse. We've got a lot of great treatment options here at Maragal Medical. And if you're someone out there, or if you know somebody out there that is suffering with acute or chronic pain, you definitely want to give us a call. We've combined medical care, physical therapy, and chiropractic under one roof. We have a special expertise in the field of regenerative medicine, and best yet, we take most insurances. Best information to get out there is to review our website at maragalmedical.com. And as we always say, we've got a wealth of information on our YouTube channel where Dr. Mike and I routinely record videos just for patient education. Well, that's it from today. I hope you learned something. Have a great day, everyone.
Take care.